Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, my name is Ratna Wahyuni. I'm the second semester student of Medical Record and Health Information Department. Here, I would like to present some information related to qualitative and quantitative analysis. First is qualitative analysis. Qualitative analysis is used when the researcher wishes to analyze data that are subjective and not numerical. This focuses on descriptive data. Qualitative research is going to be focusing on things that are up for discussion and for debate. It's going to be describing a lot of things. It will use surveys and observations and interviews along with also looking at artifacts of an area. Qualitative is going to be asking questions that deal with what and how. They are going to be asking for more open-ended questions. Qualitative data collection methods consist of interviews, focus groups, ethnography, and literature review. Next is quantitative analysis. This focuses on numerical data. In the quantitative analysis, the data is analyzed through statistical means. Quantitative research is going to be trying to definitely prove something. It is looking at research that is going to be at variables and it's trying to either prove hypothesis or possibly even disprove it. Questions are going to be focused around what, how, and does. Quantitative data collection methods consist of survey, experiments, and observations. This is the differences about qualitative and quantitative. Qualitative research allows you to formulate a hypothesis. So yes, opposite to quantitative research, this approach will yield data that's expressed in words and also require fewer respondents. The data is then analyzed by summarizing, categorizing, and interpreting. On the other hand, quantitative research allows you to test hypotheses. So you can expect to see data collected with this approach will mainly be expressed in numbers and graphs. It also requires a large sample size. These numbers are then analyzed through math and statistical analysis. Now about qualitative and quantitative analysis on medical record. Qualitative analysis. Qualitative analysis aims to identify inconsistent or inaccurate documentation. Analyze the disease process to review the documentation of medical records. Medical record analysis component. First, review of completeness and consistency of diagnosis. Second, review of diagnostic recording consistency. Third, review of recording of things done during treatment and treatment. Fourth, review of the informed consent that should exist. Fifth, review of recording methods or practice. Sixth, review of methods that could potentially lead to compensation claims. For example, from the observations of Zaldy, Mauliddin, Noor, and dr.Zaenal Sugiyanto on the medical record documents of inpatients in the first quarter of 2014 in Ungaran Hospital period showed a complete review of diagnostic records from 99 medical design data studied on inpatient medical record documents. There were 74 consistent and 26 inconsistent. This indicates that incompleteness found in the recording of incoming diagnosis is often unfilled. Next is quantitative analysis. Quantitative analysis aims to identify physical deficiencies in the filing or medical records documents in accordance with established procedure. This procedure makes medical records more complete to be referenced or ongoing care, to protect the legal interests of patients, doctors, and hospitals, and to meet requirements, license, accreditations, and certifications. Medical record analysis component. First, check the patient's identification on each medical record sheet. Second, the existence of all important reports. Fourth, authenticity review. And fourth, recording review. For example, from the observations by Puji Hastuti at BHAKTI WIRA TAMTAMA Hospital Semarang in the first quarter of 2014 showed for the identification review of 60 files studied on each form of inpatient medical records of station caesarean patients. The review of medication observed there is still incomplete data, namely the name, age, medical record number and gender, wards and classes, the way the patient exits, and the patient's state of exit. I think it's enough. Thank you for your attention and see you.